Stewart Healthcare is in bankruptcy, closing hospitals in nearby Massachusetts. A seriously disgruntled customer murders the CEO of United Healthcare. What is going on with healthcare in the U.S., and how is it affecting persons with disabilities? I'm Annette Bourbonniere, and this is Nothing Without Us, stories and discussions of meaningful inclusion. We believe people with disabilities should be included in all aspects of life. So access to health care for anyone has always been in a state of flux. In the 1950s to the early 1970s, almost everyone had a family doctor, and it wasn't all that difficult to get to see your family doctor. If you were working, there was a high likelihood that you had health insurance. People who did not have insurance were able to be seen in health centers and hospital clinics without charge. Physicians in the community would volunteer their time in these clinics. Overall, though, health insurance paid for hospitalization and expensive tests. People would pay for their own medications and office visits out of pocket. Since people over the age of 65 were not working anymore, not like today, like I am, but they were not working anymore, they did not have any health insurance. And that's when Medicare came into the picture in 1965. There were a few more rules than there needed to be, but that's what happens with anything with this government. But overall, it worked pretty well for most people, at least originally. Other plans became available that would help with the deductible and copays. Once Medicare came about, other insurance companies started to help to pay for office visits and lab tests, and pretty much mimicked what Medicare was doing. Groups formed and physician groups formed, health maintenance organizations sprang up. There was an emphasis on educating patients and teaching people to be responsible for their health care. And ensuring good health habits and making sure you were the one that would follow up. Well, now things have changed a lot. All of health insurance has become extremely complicated. It is nearly impossible to compare one plan with another. None of them will really cover everything that you need to have covered. On top of that, there are pharmacy benefit managers, which are companies that are supposed to help pharmacies save money and deal with insurances, but they really turned into another cost sandwiched in between the pharmaceutical companies and pharmacies and passed on to consumers. I hope to do a whole episode, or maybe more than one, on the problem with pharmacy benefit managers and how they affect people with disabilities. But somewhere along the line, medications that cost very little to make and began to have charges with skyrocketing copays. And then we find that Congress made a law that would not allow Medicare to negotiate with drug companies, which again set the costs, the prices, out of sight. Thankfully, President Biden has made some headway in changing that negotiation with drug companies for Medicare, but we're still a long way from getting some equity in there. The insurance companies frequently insist on prior authorizations for necessary medications, equipment, and even treatments and procedures. They set limits on how much care they will provide or cover, forcing primary care physicians, which are so scarce now anyway, but they're forcing them to spend hours writing prior authorizations and justifications for appeals, and forcing their insured to do appeals, sometimes repeatedly. Hospital systems that own medical practices have justified their own actions of setting time limits for physician visits by stating that this is better for patients and improve patient access. Instead, they reap great profits, costs go way up, patients are allotted somewhere between 7 and 10 minutes for routine office visits, and because of this, physicians are unhappy, some leaving medicine altogether, because of what they term moral injury, the inability to practice in a manner consistent with their education, training, and Hippocratic oath. Because most physicians really go into medicine to help people. Most. Because the scheduling is so tight, patients can't be seen on an urgent basis by their own doctor. In fact, their own doctors may not be available for weeks or months because of this type of scheduling. So much for the concept of primary care doc. Improved patient access? Right. The CEOs and corporate investors are the ones who are reaping the profits. For people with disabilities and chronic conditions, the current state of healthcare in the U.S. is extra challenging, extra costly, and sometimes dangerous. Here are a few examples, although we will have another episode that are going to go into some of the more serious ones. But we often have to spend 30 minutes or more on the phone just trying to make a single medical appointment. If you have multiple providers, just trying to stay alive is a very time-consuming process. How can we be expected to work or even live a life? We're spending all our time trying to survive. One person I know has figured out that between delays seeing a provider, the copay to see a provider, the copay of a therapist who is a seating specialist, the multiple delays and time spent out of work, it was less costly for her to buy her own wheelchair out of pocket online without all the physician and therapist guidance. So how is this working? Not well. Others I know, myself included, have had to spend hours on the phone and writing requests to get wheelchairs repaired. Changing an appointment results in a delay of 6 weeks to 6 months because providers and hospital practices are overbooked. Every time we turn around, we have to get more paperwork done, more phone calls done, more delays just to get what we really need. Now, before talking about suggestions, I want to say that I believe violence of any kind is never a solution, and killing somebody is just absolutely wrong. I can't, even fathom that as a solution at all. However, I can empathize with the helplessness and frustration of somebody who has been trying to deal with systems that we now have. Something has to change in a major way. It's time that I think that we have a single payer system for health insurance. I know that goes against the grain, against the American way of capitalism, but there is no way anyone other than the ultra-rich will survive what we have now. Just to be clear, though, the system cannot in any way resemble our current Medicare system. In fact, every time I hear the words Medicare for all, I start shaking because that is the cause of a lot of our problems. That system is bulky and overregulated and definitely a barrier to good medical care. I can do another 3 episodes on just that topic. People often ask who would pay for a single payer system. Yes, we would. Do you know how many people tell me they would gladly pay higher taxes if they could be sure that everybody could get the health care they needed? And I'm talking about physicians and patients and lots of people. I mean, just so many. So why aren't we looking at this? I know we're all afraid of those higher taxes, and maybe our government has not done such a good job about how that is done, and certainly not fair very much lately. But countries that are renowned for the happiest people also pay the highest taxes. The reason they're so happy is that they get so much in return for their taxes. Maybe it's time to really look at this issue more closely. While I believe that a single payer system will help resolve a lot of the problems, We need to go back to private medical practices or medical practice groups that are not owned by hospitals. Hospitals that have become such monopolies are contributing to the problem, not resolving it. With a single-payer system, there would be no justification for hospital-owned practices. Hospitals certainly would not be able to say that they help solve the web of medical insurance for physicians. For people with disabilities and those with chronic health conditions, there are additional steps that could be taken. Overall, we should look at the work of the Nobel Prize-winning economist Amartya Sen, whose research showed that providing two things for its citizens helped even the poorest countries become richer. Want that? Those two things are healthcare and education, the two items that Congress seems to be hell-bent against providing. However, it's time to look at the economics of the situation and bring this country back into a leadership role. We will never get there unless we take action in these two areas. I offer my condolences to the family of the murdered CEO of United Healthcare. That should never have happened. I don't know as it's even possible to blame a single person for systems that are really unwieldy. So, I mean, it just should not have happened. And I am sorry. But as a country, let's be shocked enough about this to look at this time as a learning time and make some changes that can really help everybody. It is time. Thank you for listening. If you like this podcast, you can find it at patreon.com/nothingwithoutus, and please support us. Hit the subscribe button, give us a like, make some comments, and tell your friends. They can find me at patreon.com, on YouTube, and you can follow me on LinkedIn, Blue Sky, Instagram, and Threads. Until the next Nothing Without Us, I'm Annette Bourbonniere.